How to identify prediabetes symptoms. Before people develop type 2 diabetes, they almost always have prediabetes. This means that they have blood glucose levels that are higher than normal, but are not yet high enough to be diagnosed as diabetes. Prediabetes is a significant risk factor for type 2 diabetes and is also associated with an increased risk of cardiovascular disease. Luckily, if prediabetes is caught early enough, the condition can be reversed by switching to a healthier lifestyle. Start with step 1 below to find out more. Identifying symptoms of prediabetes. Look for increased thirst and hunger. Two of the most noticeable symptoms of prediabetes are increased hunger and increased thirst. Prediabetes causes you to urinate more frequently, resulting in a loss of fluids. This loss of fluids leads to increased thirst. In addition, the loss of fluid makes it harder for your blood to transport energy, in the form of glucose, to the body's cells. You will find yourself eating larger quantities of food and feeling hungry more frequently, as your body tries to compensate for this lack of energy. 1. Look for frequent urination. One of the most obvious symptoms of prediabetes is increased urination, which may develop abruptly. This happens as a result of the increased blood glucose levels, as not all of the glucose can be reabsorbed into the bloodstream. This causes higher levels of glucose in urine, which draws water from the blood and results in increased urination. People with prediabetes may have a daily urine output from 4 liters (1.1 US gal) to as much as 30 liters (7.9 US gal). Another way to confirm prediabetes is to look for high levels of glucose in the urine. Look for muscle weakness and fatigue. When the body loses large amounts of fluid due to increased urination, the blood is unable to transport the necessary energy to the body's cell, leading to muscle weakness and fatigue. As a result, prediabetes patients may find themselves feeling constantly tired and out of energy. Look for blurred vision. When blood sugar levels are high for a long time, body water may be pulled into the eye lenses, causing them to swell. This leads to impaired vision in a condition known as diabetic retinopathy. It is a common complication of type 2 diabetes. Look for pain or numbness in the extremities. When blood glucose is poorly controlled, blood vessels throughout the body begin to function abnormally and undergo structural changes that result in inadequate blood supply to the extremities. This leads to pain and numbness in the hands and feet. The pain is sharp and stinging, while the numbness can be described as tingling or a funny feeling in the affected area. The decreased blood flow can also prevent wounds from healing properly, which is another sign of prediabetes. Look for erectile dysfunction. One of the complications of diabetes is autonomic neuropathy, which can cause impotence among male patients. Autonomic neuropathy causes damage to the nerves and arteries in the genital area, which interferes with the blood flow necessary for an erection. How to spot the symptoms of diabetes. Diabetes affects more than 14% of U.S. adults, and almost 9% of the adult population worldwide, with more than a third of them unaware they have the disease, and many more people at risk of developing it. Learning to spot the warning signs is more important than ever. 2. Of the 2 varieties of diabetes, type 2 is more common and more closely linked to long-term obesity. The symptoms of type 1 diabetes tend to appear suddenly, and can happen to people of any weight. If you notice the symptoms of types 1 or 2 diabetes, make sure you consult your doctor or other medical professional for proper diagnosis. Recognizing symptoms of type 2 diabetes. Consider if you're unusually hungry or thirsty. Early warning signs of diabetes are being hungry or thirsty even though you're eating and drinking plenty of food and liquids. In both types of diabetes, your body doesn't get enough energy through glucose, or blood sugar. As a result, it makes you feel like you need to eat or drink more. Notice when you're tired. You experience fatigue for the same reasons you feel hungry and thirsty when you're diabetic. Your body doesn't process the sugar in your bloodstream. Since you're not getting enough energy from the food and beverages you consume, you feel tired. Take note if you complain of fatigue even though you're getting plenty of sleep and rest. Keep track of how much you urinate. When your body is operating normally, it reabsorbs glucose through your kidneys. If you're diabetic, your blood sugar, the amount of glucose in your system, is elevated. You have too much unprocessed and unusable glucose. As a result, your system will try to flush itself by producing more urine. Since your body is flushing itself, it diminishes your fluids and makes you thirstier. Bedwetting in children who don't normally wet the bed is a sign of type 1 diabetes, which used to be called juvenile diabetes. 6. Look for other effects of changing fluid levels. With your fluid levels constantly changing, effects are visible in various systems. Look for signs in your body systems that change as your fluid levels fluctuate. Your mouth will often be dry as your body flushes itself. Your skin might frequently be dry and itchy. The lenses in your eyes might swell up or change shape. As a result, you might have blurry vision or an inability to focus. Keep track of slow-healing sores or cuts. Diabetes can be a silent killer disease, since many people do not notice they have it until signs of long-term damage appear. Be aware of pain or numbness in your feet or legs. If you've had diabetes for some time, though you may not have realized it, nerve damage can lead to pain or numbness in the extremities. In diabetics, lack of blood flow damages the nervous system the same way it prevents cuts and sores from healing properly. In both cases, high blood sugar is preventing blood from moving around your body. Note any yeast infections. Men and women can both be affected by yeast infections, and diabetics are particularly susceptible. The reason is because yeast feeds on glucose, and since diabetics have plenty of unused glucose, yeast thrives. Check for infections in any moist folds of skin, such as in and around the groin and genitals, between fingers and toes, under breasts. Type 2 diabetes usually goes unnoticed, so enough time passes that your body becomes saturated with glucose, allowing for secondary indicators like yeast infections.